going? Dr. J here with another inspiring message of health. And today I want to talk a little bit about lower back pain and how many people this holiday season are suffering with acute and chronic lower back issues, sciatica. We just had a few patients come in this month alone with numbness and tingling and pain radiating down their leg. And I want to show you how I work on a lower back pain patient. And I wanted to show you some adjustments today and how safe and effective chiropractic can be. So this wonderful gentleman right here, this incredible patient of ours, came in with some chronic lower back issues, and we've been working with him, and he's actually been improving over the span of about 6 weeks. So what I do as a chiropractor, so first off, we do an initial assessment, exam, we take x-rays, and so we already have all of that established. And once I have the x-rays, what we do is we, I come up with a plan of action for all of my patients. And so what we have our patients do is they wobble for about 30 to 45 seconds. Then they come over here and they lay face down, deep breaths in and out through their nose, getting nice and relaxed. And then what I do is an assessment of the spine where I'm palpating the spine. And a big thing with lower back is leg length. So typically people have these patterns where they have one short leg, one long leg. And Jeffrey here actually has a short right leg. And so oftentimes what will happen is the pelvis will move back and it'll shift and it'll pull the femur up, shortening that leg on the side. So what's really cool is, come over here, I want to show them the leg length. So if we look at the leg length here, you can clearly see that his right leg is shorter than his left leg, okay? So what you'll notice is I'll do an adjustment on him and it will balance out his leg length. So first off, what I like to do is, so we palpate, and then I like to work on the soft tissue, get everything nice and loosened up. And what's really cool about this instrument right here, this is called a vibropercussor. This actually helps to break up scar tissue. It loosens everything up, helps to relax the patient, and it draws in more blood flow and oxygen flow, which helps to speed up the healing process. So I like to work on the whole spine and relax the areas that are really, really tight and locked up before I make the adjustments. How's this feel?
Amazing.
Most of my patients love this.
My favorite part.
I get a lot of offers on people that want to buy this from me. Okay, so we get everything nice and relaxed, and now we're going to make some adjustments. So what I'm going to do is I'm going to put Jeff into what's called a side posture adjustment. You might want to come over on this side, because I'm going to adjust the pelvis right here. So face me over here. Okay. So this is called a side posture move. And so what we do is I bring the patient over into tension, and then we make contact with the pelvis. So what I'm doing is I'm moving his pelvis, his sacrum, and his L5 all at once. And so we just do a nice setup here, deep breath in through your nose, all the way out.
Oh, yes.
And it's just a quick adjustment.
Wonderful.
I'll pay you later for that response. Go ahead and lay face down.
Oh, yeah. Wait, I'll wait for that one.
Actually lay face down, because I want to look at your leg length. Okay. And then we'll address the other side. Okay. So now, if we look at the leg length, it's completely balanced out.
Mm-hmm.
So it's nice and level now. And I'll come back over here and I'll recheck, and now his pelvis doesn't feel as locked up. It's moving a lot better now. So, I mean, that's the cool thing about chiropractic. You get those instant changes. But what happens is our bodies fall into these patterns, so our body always wants to go back to what it knows, and that's why we see our patients on a regular basis. pause. Okay, so now on this side, I'm going to adjust the pelvis, his left pelvis in the exact opposite direction. So face me over here. Relax that, deep breath in. Beautiful. So flat on your back. So now I'm going to get his mid-back. And this particular adjustment, this is what I call the hug with some extra love. It's the Chiropractic Hug, and it comes with the adjustment. So the main thing with the mid-back is we want to get the mid-back moving better because the ribs attach to the mid-back. So if the mid-back is moving better, the ribs are going to be able to expand more, and you're going to get more oxygen in every time you take a breath. So come on up for me. Nice. How'd that feel?
That was amazing.
Again, I will pay you later. Okay, so now we're going to get the neck. Now, the neck always looks the scariest when it comes to the adjustment, but I've had patients come in who are deathly afraid of getting their necks adjusted, and what we do a really good job of is I talk the patient through and tell them exactly what we're doing so it's no surprises. Now, Jeff here has been adjusted many times, so he's used to it, but what I'll do is I'll walk you through the experience so you can get a feel for it. So what we do, first off, we have an x-ray on the neck, so I know where the problems are. Most of our patients come in with a total loss of curve in their neck, lots of forward head posture. So, but every time they come in, I'm always palpating first, and I find those areas that are stuck, that are locked up. We call that subluxation in chiropractic. So what we're going to do is we're going to make contact, gradually bring the head and neck over into a slight bit of tension, and then the adjustment will be in this direction, just a little bit quicker than that. So go ahead and take a deep breath in, let it all the way out. Nice. And that's the adjustment. Now, maybe you guys heard the popping sound. Now, there's a misconception about that because a lot of people think that's like bones grinding on each other. All that is just gas being released from the joint. So just like your knuckles, when you pop your knuckles, the reason that popping sound occurs is because the joint actually stores up gas. And now we're going to get the lower part of the neck on the right side here. Okay, same thing, deep breath in, all the way out. Good. How's the force and pressure on that?
It was nice. It was soft.
Good. Yeah, I learned from my mentor. He said that he would carry around the bones of the neck in his pocket, the first two bones, and he got really good at feeling those, and he would close his eyes and he would visualize the structure of each and every bone in the neck. And he said, look, you know, the neck, it should be all about finesse and not force. And he I trained under him for 3.5 years, and we would work on the neck on a weekly basis. And so now my adjusting style is all about finesse. You know, I'd rather use less force, get the body to move the way it needs to move with as minimal force as possible. Good. Go ahead and sit up for me. Face that way. Come around this way, actually. So now what we do is after we finish adjusting, we work on the posture. I use this tool right here. This is called an arthrostem. So we want to work on the posture because your posture is a window into your spine. And the better your posture is, the more stable your spine is going to be and the longer the adjustments are going to hold. Awesome, man. Go ahead and stand up, walk around a little bit. How you feel?
a lot better than I did. I'll tell you. The tightness is gone. That's what's most important for me.
You look.
I can breathe, and I feel like my shoulders can go back.
Yeah.
And that vibrocussor. I'm gonna find one of those on Amazon.
Yeah. So it's awesome, and these results can happen instantaneously. But what I find is that, in order to get the best results with your chiropractor, is you want to get on some type of a plan. It's not just a one adjustment, rack 'em, crack 'em type deal. It's something that, just like anything, when you work out, when you go to the gym, you work out on a weekly basis, and that's how you get optimal results. So same thing with chiropractic. So what's really cool right now, we have a $28 special holiday offer that's going on for the rest of this month. And what our patients primarily come in with is neck pain, lower back pain, sciatica, headaches, and migraines. So if you're suffering with those issues and you're local, why not take advantage of the $28 offer to get the x-rays to see exactly what's going on with your spine, and then we can move forward from there. And if you know anybody who's suffering right now with any of those conditions, don't let them suffer through the holidays. Give the gift of health. It's only $28, and we can get a full assessment on what's going on with their spine and maybe give them some answers that they're looking for. I've had patients come in, sleeping problems, chronic back issues. They've gone physical therapy, they've been on the muscle relaxers and painkillers, and they've been doing that for months to years with no results. They come in and they drastically notice a difference with just a few adjustments. And the reason for that is when you clear out the neurological interference and you have better brain-body connection, the body can essentially heal itself from the inside out. And so what happens is, because the body's starting to function at a higher level and we're clearing out that interference, a lot of these things go away in a short amount of time. So anyway, special offer, take advantage of it. If you know anybody, please give them our phone number. You can comment below, you can direct message me. You can call the office at 916-587-1276. Other than that, have a great day and God bless.